Welcome to the latest webinar in the Subtle Insights webinar series presented by Subtle Medical. My name is Anna Minihart Borroni, and I'm the head of marketing here at Subtle Medical. I'll be your moderator for today's talk. I'd like to introduce you to our speaker, also on the screen, Dr. Ajit Shankaranarayanan. Hi, Ajit. Good morning.
Good morning, Anna.
Hi. Ajit is the head of product partnerships and operations here at Subtle Medical. Before he joined Subtle, Ajit spent 16 years with GE Healthcare as the global manager for neurology in the MR division. So we are thrilled to have him here as our expert opinion leader today. So thanks again for spending time with us this morning, Ajit. In today's talk, a review of key MR technologies on the market. We'll cover the newest features in imaging technology, including hardware and software, as well as the key considerations and trade-offs when deciding what's best for your organization. We'll also discuss how AI software solutions, such as Subtle's own Subtle MR, can improve image quality without purchasing expensive upgrades or hardware and equipment. We'll try to keep this presentation to around 30 minutes or so and leave plenty of time for live Q&A at the end. Please feel free to submit your questions throughout the webinar as they come to mind. There's a Q&A icon on your screen, I believe at the bottom, where you can submit your questions anonymously at any time, and we will get to those after the presentation. Without further ado, Ajit, feel free to begin your presentation.
Thank you, Anna. I'll just turn off
your video. Okay.
Okay. A very good morning to all of you. It is actually at least morning here. So as Anna said, what we're going to do is to overview some of the key technologies available on the MR scanners today. A brief agenda here. I would start with a brief introduction to MRI and then move into the key considerations or the metrics and trade-offs which can actually come up during the decision-making process for a specific organization when they're trying to upgrade the performance of their fleets. I will also discuss this new some of the new hardware and software technologies which are available in this context. And lastly, I will also describe a software-only solution, AI-powered software-only solution called a Subtle MR, which we offer, and how does it actually perform across these metrics. So a brief intro to MR. MRI, or magnetic resonance imaging, is a medical imaging technique which is used in radiology to perform images, to actually obtain images of anatomy as well as physiological processes of the body. So what are the advantages of this modality? First of all, it has no ionizing radiation, which means that it is extremely safe. It is also very flexible compared to some of the other modalities, that it has multiple physical and instrumental parameters which can be adjusted to actually get new information. This can be good or bad, but mostly good. It also allows anatomic and functional imaging possible compared to other modalities, basically. So essentially, it's a very, very flexible instrument. However, the scan times for these modalities are much higher compared to some of the other imaging modalities. Because the MRI machines are extremely complex, it actually becomes very expensive. And the process of imaging a specific body part makes this instrument a little bit more claustrophobic for the patients. So over the years, in the field of MRI, the advances in the MRI has been to remove these disadvantages. So what have been the advances in MRI? I want to actually show you a picture, an image from a 1985 paper from Dr. Zwadsky et al., which is imaging dementia patients. This was done on a 0.35 Tesla using a 2D spin echo T1 technique. acquiring only 20 axial slices in about 20 minutes, really long, and at a very low field strength. Compared to this is an image I actually obtained a few weeks ago from our library, which was obtained on a 3 Tesla machine of using a 3D T1 technique. And this is an image of axial reformats, basically. So the technology, as the both hardware and software, has improved so much that you can actually go from the left-hand side of the image to the right-hand side. So what are the key considerations or the metrics which any institution would use to actually upgrade their instruments, upgrade their equipment? Some of them are patient-centric in terms of the image quality, in terms of the experience, in terms of how quickly you can actually get the images. The others are in terms of general institution related, how easy it can be deployed, and how compatible it is with across the fleet of scanners which an institution could have. Understanding that the more than 60% of the equipment is 9 years or old as of 2019. This is from a survey, IMD survey, which actually I got from the latest IMD survey. So, and how does the investment, how does the trade-off occur across these key considerations and key metrics?
You know, Ajit, I think this is a good time to launch a poll. I'd love to see from our attendees what they think. Let's launch a poll. This is actually for our attendees. It says, for those of you who might be on your phone, everybody can supply their answer here. The question is, what is most important to you when choosing a new MR technology? Based on what Ajit just shared, is it speed and efficiency gains? Is it improved image quality? Is it improved patient experience or ease of deployment? Compatibility across your entire MR fleet, or a combination of all of the above. You also have the option for other if there's something else that comes to mind. But let's give everyone about another 5 seconds to submit their answers. Okay, we have about 70% of folks who have voted. So let's see, it looks like, I'm gonna share results. Looks like the majority say it's kind of a combination of all of the above. And second in line is improved image quality, followed by speed and efficiency gains, followed by compatibility across the entire fleet. So good to know. Great. Okay, Ajit, we can get back on track.
Should I take the polling out? Okay, so let's start with the discussion around the features in the scanner technology, around hardware technology. What I wanted to actually talk about, some of these key hardware technologies are the magnet technology, how that has come along in terms of the field strength and the bore size. The gradient technology in terms of the amplitude and the slew rates, which greatly contribute to the image quality, to the performance of a particular scanner. And the RF technology, the coil technology, how that has actually come along in terms of the elements and the channels, basically. So all three of these are very critical technology, which has actually kind of helped in advancing the MR from where it was in early days compared to what it is today. So the magnet technology in terms of the field strength, MRI requires a magnetic field to actually get images, and it has to be strong and uniform. It has to be strong, and the strength of a magnetic field is actually determined by their field strength. In the commercial systems, there are magnetic systems available between 0.2 and 7 Tesla. It has actually advanced from really low field strength with permanent magnets to the advent of superconducting magnets, which has actually helped in increasing the field strength from 1.5T to 3T to 7T to 10.5T also, albeit it is in a research mode. The field strength is directly proportional to the base signal which you actually acquire from the patients. And so increasing a field strength is extremely important for increasing the signal to noise ratio in these images. And once you have a higher signal to noise ratio, you can actually play around and trade off other pieces to actually optimize the pulse sequences. In addition to that, the bore size is also extremely important because the patients have to go into this bore. It is the cylindrical opening in the middle of that magnet where the patient lies. And the bore size also has actually made a lot of advances in terms of improving the patient experience within a scanner, and not only speeding up the acquisition, but also making the patient comfortable within the scanner. And as you can see, there are various kinds of MR systems available with different bore sizes, 60 centimeter, 70 centimeter, the open magnets, and even the standing magnets from Phonar. So, but in reality, if you look at this, again, looking at the IMD survey, the reality is that about 85% of the install base is either 1.5T and 3 Tesla. And there is a reason for that. The field strength cannot go higher because it actually increases the complications from a sighting perspective as well as from the MR physics. Similar to that, about 60%, about 80% of the scanners are either 60 centimeter or the 70 centimeter in reality. This is again a compromise between higher signal to noise ratio and also the patient comfort. So you can actually see how the field has compromised, how done the trade-off in terms of the field strength as well as the bore size. Going beyond this, as an institution which is looking at upgrading based on their magnet technology will be extremely vendor dependent, first of all, and it is also extremely expensive proposition just because each vendors have their own way to actually upgrade these scanners, and there are other complications involved in terms of the sighting as well as maintaining of the scanner in terms of the superconducting nature of the magnets. So in short, a magnet technology upgrading a magnet technology can be a pretty expensive proposition. Let's go to look at the gradient technology. The primary function of gradients is to allow the spatial encoding of MR signal. The magnets allow the base signal to actually get generated. Gradients allow the spatial encoding of this MR signal, extremely important from an imaging perspective. And there are two specific parameters of these gradients which are responsible for efficiency gains as well as improvement in the image quality. They are called as amplitude as well as the slew rate. Amplitude being the strength of the gradient, and slew rate is the rise time or how fast you can actually get to that amplitude. In recent years, there have been a lot of advances from a gradient technology perspective. I show on the left one of the most premier scanners available in the field, which is the Siemens Prisma, which has an 80 millitesla per meter and 200 millitesla per meter per millisecond slew rates, which is the highest known in the field. But if you look at from a reality perspective in terms of the install base, most of the scanners are within the 30 to 45 millitesla per meter and 150 to 200 millitesla per meter per millisecond slew rates. And that's where the field has actually compromised itself, where you can affect 90% of the imaging sequences. You can actually obtain really high quality images from those sequences. It actually also, from a cost perspective, is lower. Any increment in terms of the gradient technology or absorbing the gradient technology into the institution has to have a very high return on investment. It is extremely vendor dependent. Not every vendor has these high gradient technology solutions. And it also, from a protocol perspective, it affects a very niche protocols in terms of the gains you actually see from image quality as well as efficiency. And in terms of upgrading of these gradient technologies, it is very similar to the upgrading a magnet technology. It becomes very expensive proposition. Again, requires more than the hardware constraints, it also requires the sighting constraints. The third technology which I wanted to actually discuss is the RF technology, the coils. The coils are again a very critical part of the MR environment, MR system. They are the antenna for the MR system, and they are the hardware which actually receives the signal or also transmits the RF signal. In recent years, there have been many advances in terms of the RF technology coils, which has led to these kind of arrays of coils from different vendors. This is on the left-hand side, I show a whole body array for the vascular imaging. You can actually see number of channels which is spread across the body. Is a high channel count head and neck coil. It's a very specific to the head and neck, but with a high receiver count, high channel count coil. And extremely innovative air coil, which has been actually introduced by GE, which actually allows for a much more lightweight coils, but performing at the same level as what the previous coils actually did. So you can actually think about this as a library of coils available for the users to choose from. And it actually does lead to efficiency gains, because when it combines with some of the software technologies available like parallel imaging and compressed sensing, it does give you that efficiency gains, as well as in terms of the improvement in the image quality. However, RF technology mostly is vendor dependent. They are actually, each vendor has its own coil library. Each vendor has its own performance requirements for each of those coils, basically. However, they are much less expensive compared to upgrading a gradient or a magnet in this case. So all three of these hardware technologies are extremely important to actually make an MR system function as optimally as possible. However, looking at into the future, going and trying to actually upgrade using some of these hardware solutions, it has to actually give an extremely high ROI for institutions to actually go ahead and institute these kinds of upgrades. Next, I will actually move into the features of the scanner technology from a software perspective.
Actually, Ajit, why don't we ask the attendees? I'm curious, especially in the environment we're in right now. I'm going to launch another poll here. We'd love to know, are you looking to upgrade or purchase a new either MRI scanner or technology at the moment? The answers are either no, yes, maybe in the next 6 months, or yes, maybe in the next year or more. So let's give everyone about 5 more seconds to answer this poll. Okay, give you a few more seconds. All right, I will wrap it up and share the results. So it looks like the majority of our attendees on the call, looks about 60% aren't necessarily in the market to upgrade at this time, could be a product of the environment we're in. And it looks like maybe in the next year, about 30%. So interesting and good to know. Okay.
Okay, thank you, Anna. That's very interesting. So let's go into the, so the next section becomes even more important, because you are, as the poll shows, there is very less interest, at least in the next 6 months, to improve, to upgrade the hardware. So we'll actually look at some of the software solutions which are available to improve the performance of the current scanners. Okay, so some of the key MR software features, there are multiple different software features which I cannot cover in this particular webinar, but I want to actually highlight 3 of them. The first one is the parallel imaging techniques. There are multiple different parallel imaging techniques available. They are one of the most robust software technology which has actually kind of become ubiquitous across, has wide applicability across different clinical areas. A more new technology called as synthetic MR. We'll actually just go into this quickly. And then, as Anna mentioned, we'll actually look into the more newer technology, which is deep learning based image reconstruction and processing, basically. So I will actually touch upon these three techniques, and obviously there are other software features or software technology which can also be included, but because of the time constraints, I'm highlighting these three. So let's look into the parallel imaging. Parallel imaging, as it was introduced in late 1990s and early 2000s, is a very widely used technique where once the placement and the design of the coil is known, of the RF coil is known, it's it's easier for us to undersample or acquire less amount of data. So it directly actually helps with the reduction in the imaging time while keeping the image quality, maintaining the image quality. Different vendors have different techniques which they have actually provided for different sequences. For example, Siemens provides techniques like GRAPPA, KIPI, etc. GE actually has technologies like ARC in their actually portfolio, which does similar things in terms of increasing the efficiency of these sequences while providing equivalent image quality. Very recently, new techniques like compressed sensing have actually come along, which are iterative constrained reconstruction methods, which are data-driven and not entirely coil-dependent, basically. So they are more data-driven iterative reconstruction, a precursor to some of the deep learning reconstructions, which we'll talk about a little bit later. So there is a wide array of techniques available, and a lot of these techniques are very robust. They have actually been in the field for nearly 2 decades. They have been actually improved, optimized by, and most of these techniques obviously are provided by the other vendor solutions. So in terms of the parallel imaging, they do actually allow you to gain that efficiency of, gain the performance. The image quality, I did not highlight as high because as you increase the factors, the parallel imaging factors or acceleration factors, or you try to go for higher efficiency, the image quality can suffer depending on what coils do they use. Obviously, for compressed sensing, it's different since it is a more data-driven method. So it's highly vendor dependent, as I mentioned. It is each vendor has their own solutions. Most of the parallel imaging techniques do depend on the coil design and how many elements or how many channels are available so that it can actually improve the efficiency factors. But it is a very robust software solution and much less expensive compared to some of the hardware solutions to improve some of these metrics. So let's look at synthetic MR. Synthetic MR is a simulation method in magnetic resonance imaging. It's been a pipe dream for the MR scientists for a long time to actually simulate the multiple different contrasts which can actually be obtained using MRI since it's so flexible. So in recent years, it has become much more feasible. It has actually become more robust in terms of having such a method in the field cleared by the FDA. And one of the companies, the SciMRI company, which actually is looking into this. There are other techniques like MR fingerprinting. This is again another technique where you use a very simple sequence and by using a dictionary method to actually generate quantitative maps for that particular image. So multiple of these synthetic MR methods are available in the field. Some of them are FDA cleared, especially the SciMRI solution, which is available on all the vendors. And some of them are more researchy topics, basically MR fingerprinting, like MR fingerprinting, which has still not been cleared from a clinical usage perspective. However, synthetic MR is a very extremely new technique. You do get the efficiency gains because you're using one single acquisition to generate multiple 8 to 9 different contrasts in the body. So there is a huge efficiency gain using this method, which also leads to improved patient experience. However, being a newer technique, being looking into the hardware and software constraints, the image quality can suffer in these cases. Again, it is a very highly vendor dependent because it is integrated, it has to be integrated into the acquisition and the reconstruction pipeline of each of these vendors. And right now it is very limited to brain clinical area as well as 2D techniques. Obviously there are more advances from a research perspective, and these techniques will actually only grow in the future. It is less expensive compared to some of the hardware solutions being a software only solution. Lastly, I would like to actually talk about the deep learning reconstructions, which have actually caught the eye of the community. In contrast to the constrained reconstruction methods like compressed sensing, deep learning avoids this complicated optimization parameter tuning by using using enormous data to actually train some of these neural networks, basically. In recent years, deep learning reconstructions have been actually shown for various applications in MR. For example, in image enhancement, artifact reduction, improving the speed of the reconstruction, and also gaining efficiency. Couple of techniques which have actually been cleared from a clinical perspective have been actually put forward by vendors. For example, the GE Air Recon DL, extremely impressive image quality improvement. And the Canon DL Recon, which is available on the Canon system. So, so the field, from a innovation perspective, is moving towards this. And I have only highlighted few of these techniques. There are other case-based methods which have been actually in the research area, but they're not mature enough, as has been shown in the recent PNAS paper. So in terms of the metrics, it does actually help with the efficiency gains, especially some of the GE technique has shown that. It improves the image quality and it improves the patient experience. Again, a very new technology, a very vendor-dependent technology. Not all the vendors have the same kind of reconstruction methods. They don't have the same applicability across the field. And it's very limited right now, since it's a new technology. The two techniques which I just mentioned got the FDA clearance over the last 3 to 4 months. However, being a software-only solution, again, it's much less expensive compared to using a hardware solution to actually affect some of these metrics.
Great.
Lastly, oh, go ahead.
Oh, yeah, sorry. I think this might be a good time to launch our last poll, Ajit. So I'm sure a lot of attendees on this webinar today have done testing, piloting, and evaluations of different AI solutions. So we're curious, want to get some feedback on the key factor that, if any, that's kept you from actually purchasing or deploying an AI solution at your institution. So I'm going to launch this poll and I'll read it out to everyone. So what is the key factor that's kept you from purchasing or deploying one of these AI solutions? The first option is struggle to prove ROI. Second, unpredictability of artificial intelligence or deep learning. Third, the cost. Fourth, lack of clinical evidence. Fifth option, getting the right decision makers on board. Maybe clinicals on board, but again, you're struggling to prove that that ROI piece. So, and then maybe there's a different option, which is at the very bottom, other. So let's give everyone about another 10 seconds to answer this poll, and then I'll share the results. Give him another 3 seconds. Okay. I will share the results. It looks like the majority of folks Interesting. So lack of clinical evidence behind some of these AI technologies is what's prevented the majority from purchasing and deploying an AI technology thus far, followed by a tie between either unpredictability of AI, meaning perhaps there's an exception to the rule you're concerned about, or getting the right decision makers on board. Interesting. And then finally, maybe other options, or the struggle to prove an actual ROI at your institution. So great context. And thanks for sharing. Okay.
Thanks, everybody. That's very interesting, Paul, for us. So, the last section, I would want to actually kind of spend a little bit of time on discussing the AI-powered image enhancement software, which we have been actually, which we got the clearance a few months ago, called as SubtleMR. So SubtleMR is a deep learning-based image processing software that can be used for enhancement in MRI images, either by improving sharpness or improving the sharpness of the images, or performing denoising. So right here, you can actually see there is a flexibility of methods which we have got clearance for. Again, one of the things which I do want to note here compared to some of the other DL reconstruction software methods is that this is a purely DICOM image-based and not integrated into a reconstruction pipeline. So what makes SubtleMR unique? And we have been doing some of the clinical research with our research partners, and would like to actually show some of the examples which we have, from these clinical research studies. So this is a site act. This is from a couple of different sites, UCSF, which is our strategic research partner, as well as RadNet. You can actually note that these are two different systems. One is from a GE 1.5T, and the other image is from a Siemens, newer Siemens Skyra 3 Tesla. Plus, another thing to note here is this is a totally different contrast, a T2 flare in a 3-dimension. It's a 3D T2 flare. And on the right, it is a 2D sagittal T1, which is actually part of a routine spine exam. So what we have actually worked with these sites is to see how best we can actually restore the image quality or enhance the image quality when the base image quality is like this from their accelerated protocols, basically. So you can actually see that there is a significant improvement in the image quality on the left-hand side, and again on the right-hand side, across the two different scanners, across the two different contrasts, and the two different field streams, basically. So it is exactly the same algorithm which has been applied on the left-hand side as well as on the right-hand side. So these are single contrasts. What happens if an institution wants a more dramatic improvement in terms of the image quality, not only on one sequence, but across their protocols? This is a research study which we are actually doing with another research partner, UCST, where they are actually applied SubtleMR to their MS lesion protocol, basically, which is fully 3D. It's mostly 3D sequences. And you can actually see some of the image quality before and the image quality after the enhancement applied using SubtleMR. Obviously, the post contrast images are not 5K approved right now. But the significant improvement in the image quality, which you can actually get consistently across the protocol, is a big benefit, as we have actually talked to various stakeholders in the institution. This is another example as SubtleMR is applied across the protocol for all the different contrasts. This is in an L spine on a 1.5T system. The images were acquired at RadNet. And you can actually see the improvement in the image quality, consistent improvement in the image quality across the different contrasts. And this actually allows the stakeholders to actually argue for a more comprehensive improvements, which are shown by SubtleMR. So looking at these metrics, at the key considerations which we had actually defined earlier, it does give you some efficiency gains, as we have actually shown in multiple clinical research studies, which are which have actually been presented at different conferences, as well as which will be coming out. And then it also helps improve the image quality and the patient experience. And it is not vendor dependent because it actually starts out with from a DICOM image. It is extremely vendor agnostic and has a wider applicability. Obviously, as being a software only solution, it is also less expensive compared to some of the hardware solutions. So in summary, what I have done here is actually did an overview of the different key technologies, key MR technologies, both on the hardware side as well as the software side, and try to actually use the key considerations or the key metrics, whether it is a patient care metric, whether it is an ease of use metric, to actually line them up against each other. And what we find is, in general, the software technologies are more from a return on investment perspective, are more critical, more easy to be applied across a fleet of scanners which an institution may have. And with that, I would like to actually kind of thank everybody who has joined this particular webinar. And if you have any questions, I think next is the Q&A session. Thank you. Thank you all.
Great. Thanks, Ajit. Great presentation, very comprehensive and insightful. We've actually received several questions already from the audience, so let's go ahead and launch our cameras if you'd like to, and we'll jump right into Q&A. Hello again. You want to just bump to the next slide there, and I will pull up the list of questions.
Yep.
Okay. Wonderful. Okay, so we encourage everyone to continue to stay on. Again, if you want to submit a question, if you joined late, I mentioned earlier, you can submit a question. There's a Q&A icon, I believe, at the bottom of your screen. The questions are anonymous, so feel free to submit away and we will try to get those answered for you. Okay, so first question, is subtle MR FDA approved for pediatric?
Great question. So the clearance does not restrict us from an age perspective. Obviously, we have been actually working with institutions which are focusing on pediatrics. For example, the Sick Kids in Toronto, Boston Children's Hospital. We have been actually having a lot of research activity going with these institutions. Yeah, from an FDA clearance perspective, there is no limitation from an age perspective. Obviously, the training model or the training data has to be augmented from a pediatric perspective to for this DL model to actually perform optimally. But from a clearance perspective, there is no restriction.
Okay, so was there pediatric data used at all when we were training our deep learning?
Yes, so we did use pediatric data from a couple of our research partners. We did use training data from our from a pediatric population. However, you know, as we one of the good things about the DL algorithm is the more the training data, the right data is actually fed into the DL model, it actually becomes more and more optimal for that particular patient population. But we did actually use pediatric data as part of the training data.
Great. Who is using subtle MR currently?
We have, so subtle MR was launched, was cleared last year, and it was officially commercially launched in January. We have several strategic partners who have actually who have been using subtle MR, for example, RadNet, UCSF, UCSD, and you know, we have also some of the other imaging centers like Precision and ProScan Imaging. They have actually started using subtle MR as their image enhancement software solution, basically.
Okay, this next question is how much is Settle MR? So I'm assuming they're asking about the pricing model around Settle MR.
Settle Ammar, we specifically look at, so the pricing model is a subscription model. And I think what we do is we work with the institution to determine the optimal pricing based on the volume, the case mix, and also our ability to affect the protocols within that particular institution. So, but in general, it is a subscription-based model.
Okay. Okay, so I'm just going to go down the line here. Some of these
Okay.
won't necessarily relate to each other. Do you have to send thin images special for these recons, or are they the same as those used for routine clinical reading?
So yes, so all the images which you saw, which were actually sent to Settle MR for processing, are routine clinical imaging. There was no change in terms of the contrast parameters as well as the slice thicknesses or anything. There is no specific restrictions on the thickness of slices. To answer this particular question, the parameter changes are not necessary for this because we are actually improving the image quality. If the site has actually used an acceleration method which is available in their institution, we basically just enhance the image quality on top of it, basically. So there is no parameter, changes like slice thickness or any other contrast parameters.
Okay. The next one is, based on your technical experience, which 3T manufacturer would you choose?
You want me to actually be biased? Okay. I don't, I don't want to be biased. I would say we have used we have used in our training data set images from all the three different manufacturers, GE, Philips, and Siemens, for training this algorithm, basically. So from an algorithm perspective, don't have a bias. Obviously, market share for some of these vendors is higher compared to some of the other vendors. So we do have, the amount of the training data from, a vendor like Philips is lesser compared to Siemens and Philips, basically. But there is no bias. There is no specific bias to choosing one or the other vendors from a 3T perspective.
Got it. Well answered. The next question is, can Settle MR be adapted for non-clinical research MRI?
Yeah, it can be applied. It can be definitely adapted to non-clinical research MR. I would say the question is related to animal imaging. Yes, it can be. The key thing there is right now we don't have any training data sets which actually come from that particular population. So as long as there is enough training, enough training data set from a non-clinical population, the Settle MR, the model itself should actually work in terms of providing the enhancement.
Okay, this next question is, Settle MR software package does it provide any flexibility in modifying reconstruction pipeline, or is it more UI based with limited options?
I think the question is, does it integrate into the reconstruction pipeline, or so I can give you that answer. I don't know whether that actually answers the specific question. We consider Settle MR to be more flexible because it does not integrate into the reconstruction pipeline. It does not depend on that because we are actually looking starting from the DICOM images. Obviously, Settle MR can be adapted to actually work like some of the DL reconstruction methods, which I had actually kind of mentioned before. But from being a third-party software, it is extremely beneficial for us to actually start from a standardized DICOM images. It actually allows us to affect more of these scanners from different vendors, different fields, and enhance their performance from a performance perspective. So I don't know whether I answered that question, but yeah.
If you didn't, then the person who submitted that, feel free to submit another question, maybe clarify if we didn't answer that to your liking. The next question is, if we wanted to, can we retrospectively apply subtle MR to all of our years worth of stored MRI?
Yes, one of the modes of operation is an enhancement software. So the input images, whether it is retrospective or prospective, can be used to improve the image quality. Obviously, being a retrospective, you have a little less control on the base image quality which is coming up. But subtle MR will, since it starts with the DICOM images, it can enhance the image quality for those images also.
Okay, and the next question is, does subtle MR work with downstream applications like neuroquant, etc.?
Yeah, so as we have shown in a couple of abstracts which have been published at ASNR, as well as which will be shown at ISMRM, this ISMRM, the virtual conference, we have shown high degree of correlation between the quantitative values derived from the input images compared to the output images. So that correlation has been shown in that particular research. The amount of data sets we have is not very high. Obviously, we are just starting to do that kind of a research where we are trying to make sure the subtle output from subtle MR works equivalently with the downstream applications like neuroquant, like some of the other quantitative methods, quantitative applications. But we have started that process by publishing at both ASNR and ISMRM some of the initial results which we have actually gotten from the limited amount of data sets.
Great, Ajit. What I did actually in response to that question is, if you check, if everyone checks the chat box, I've linked our publications page on our website. If you go to the publications page on the Subtle Medical website, we've included many publications, especially on the top, the more recent abstracts and research publications that we have. Many are for Subtle MR, some are for our other product, Subtle PET. But I believe that the NeuroQuant abstract is included here, as well as several others, should anyone like to take a look at those and download. Most of them are linked unless they've been presented yet. If they haven't been, they're not downloadable yet. But so feel free to access that link in the meantime. Okay, next question. Is there a lower limit of required input image quality or minimum parameter requirements required for subtle MR to function optimally?
Yes, there is a lower limit and that, excuse me, that depends on how we have trained the CNN basically in this case. There is a certain noise limit basically which the algorithm can actually improve upon, and if we go below that, the improvements may not be optimal basically. So we do actually specify that as part of our deployment process in terms of where how low can a site go with from an input image quality perspective, and that is something which obviously I think we are working on to actually make it even lower, but you have to start off at some point. But there is a lower limit, at least right now, for us to for the subtle MR to actually show that significant improvement in the image quality.
Great. We have about 3 or 4 more, so if you guys can hang on the line, we'll try to get through these. The next one is, our institution doesn't support a subscription-based option. So do you offer a one-time solution. I could probably answer that for you
Yeah.
and say, if there are any questions around subtle MR implementation or deployment options, pricing, or you just want to learn a little bit more about the products in general, feel free to email sales@subtlemedical.com. And we'll definitely get back to you. But I think the general answer is, we're early enough to where we're able to work with anyone to come up with a solution that works for any institution really out there at this time. Do you want to add anything to that, Ajit?
No, that's good.
Okay. Okay, and so the next one is, does Subtle MR use our data to train our model?
No, we don't
Assuming once
use.
it's implemented or
Yeah.
deployed.
So once it's been implemented, we don't use any other data from the sites. We have strategic research agreements with research agreements with strategic partners, sorry, who actually provide us the wide variety of data which we actually use to train the model. Obviously, for the improvement of the model, we are continuously working with these research partners to get better data, get more of a certain kind of data to actually make the algorithm more stable, more robust. However, once they are implemented, once they are actually deployed, we don't use any data for the training.
Okay. And you spoke to this a little bit in your presentation. This person is asking, remind me why I wouldn't just use a vendor's solution and would go with something like Subtle MR.
Yeah, absolutely. I think there is always that choice of using the vendor solutions, as they are available. As I actually mentioned in my talk, a lot of these vendor solutions are initially, or the newer solutions are initially actually applicable in a certain limited use case. For example, the GE DL Recon is only available on their 3D systems, basically. So an institution which has a fleet of scanners, which are 1.5Ts and Siemens and Philips and GE, they're only able to improve the performance of a certain number of scanners within that fleet. In contrast to that, Subtle MR, being a more vendor agnostic solution, allows you to actually improve the standard of all those scanners in the fleet, basically. Theoretically, obviously, we haven't shown that. That is something which we are working on. But it has the ability to actually improve the performance of all the scanners in that field, whether it is a new scanner or an old scanner, whether it's a 1.5T or a 3 Tesla, whether it's a GE, Philips, or Siemens, basically. Just because our training data has so varied that the CNN which we use has been trained to look at those images, basically. So I would say that is the difference. Obviously, I think an institution based on their needs can use the vendor solutions. There is no, the vendor solutions work, at least from the images which I have seen, they actually are really extremely great. But this ability of, applying it to the institution as a whole actually kind of is limited when we're actually using the vendor solution.
Great. I think we only have one more question, and that question is, how quickly and easily can Subtle MR be deployed?
That's a great question. I didn't actually touch upon the deployment aspect of any of these solutions. From a Subtle MR perspective, being a third-party software, it is extremely simple in the sense that once you actually, it actually sits between the modality, which is here, it is MR, and the PACS system. So it actually requires a VM to be provided by the institution. And once that VM is provided, we can actually do remote installation of the software, as well as remote observation of how the system is performing, basically. And that is the gist of the deployment in general. Obviously, there are few details, but as an overview, that is the gist. And once it is installed, it just runs in the background. The images from the modality go to the VM, where we actually compute the processing, and then the computed image is actually sent to either PACS or to the modality back itself. So it's a very simple deployment model, and I think most of the third-party softwares follow that, basically. very streamlined.
Great. That was our last question. Ajit, anything else you'd like to add?
No, I think that was great. The different questions which I was able to answer. And thanks everybody for joining the webinar, and be safe. Thank you.
Yeah, thank you. And we really appreciate everyone joining today. I want to thank Dr. Ajit Shankaranarayanan also for allowing me to call you Ajit throughout the presentation. So I don't get too tongue-tied, for your valuable insight today. And thanks for everyone who joined today's webinar. We will post this on our webinar, or on our Settle Medical YouTube channel, as well as on our website on the Settle Medical Insights page. We'll follow up with you via email with a link to the recorded webinars so that you can access this again. And again, as I mentioned earlier, if you have additional questions, either for Ajit, for our team at Settle Medical, please email sales@settlemedical.com and we'll follow up with you offline. We do try to do an educational webinar about quarterly. So stay tuned and we will keep you updated on the next one. And we hope that you will join us again. Stay safe out there, and we hope to see you soon. Signing off.